probably have heard that the thyroid is a part of the body that helps control metabolism, right? And it gets a lot of attention when we struggle with weight loss or even weight gain. Did you know that your doctor most likely is missing some key markers when they're checking your thyroid? Hi, I'm Dr. Emily with Enlightened Functional Medicine. Sluggish metabolism really is frustrating when you're trying to hit some goals, weight loss, or just to get some energy and strength. Can you identify with not being able to get those goals? Ugh. Let's dig deeper into what exactly the thyroid does for us and what should we do if we're struggling with metabolism issues. So the thyroid is a gland in your neck that controls your metabolism with a few hormones. T4 contains 4 iodine atoms, and T3 contains 3 iodine atoms. These two hormones are created by the thyroid, and they tell the body cells how much energy to use. Each cell on your body has receptors waiting for that active form to log on to those receptors for those hormones to connect and to work. But before the thyroid releases those hormones from your neck, it has to get the signal from your brain. So you can see there's a whole lot of steps that regulate your thyroid, which start your brain going. It starts and it gets it signaling. So they have to be sending the right signals. Now, when we think of sluggish metabolism, there may be many reasons that may not even begin with your thyroid. So we have to start there. We got to make sure we're doing a good differential and thinking, what else could this be causing? How could this metabolism be a little sluggish? So let's think about first thing is blood sugar dysregulation. Maybe there's too much sugar in your diet. And for most Western Americans, there is. So too much sugar in your diet can really affect blood sugar, causing you to feel fatigued and causing that sluggish metabolism that you might be blaming on some other things like your thyroid. Number two item that might really be causing that sluggish metabolism is that your macros are not dialed in. Macros are how your food breaks down into 3 different things. When you look at any food or any drink, they should break down to either fat, protein, or carbohydrates. Those 3 things are called your macronutrients. So maybe they're not in the right ratio. Maybe there's way too much carbs, which is sugar, and not enough protein in there. Or maybe fat's just too low or too high, depending on what you're doing. So another reason is that maybe you have some nutrient deficiencies going on, like B vitamins that are depleted. Maybe you have iron deficiencies. Maybe you have really heavy periods if you're a woman. And there's some others that really we can look into with more micronutrient testing, which is fantastic, to identify what is going on with your nutrient status. Are they breaking down? Are they absorbing in your body? Something else that we need to consider is sleep. How are you sleeping? When are you sleeping? How much are you sleeping? How deep are you sleeping? There's some really cool wearables out there that you can start tracking your sleep, or just a sleep journal. Hydration is huge, is absolutely huge. How are you getting hydrated? Are you drinking enough water? What type of water are you drinking? And is the water you're drinking actually getting into your cells? Something you may want to consider. Maybe your family history is also something that you need to consider in terms of metabolism issues. Maybe there's some female hormones that we really do need to check. And finally, maybe that thyroid is something that's off kilter that needs to be adjusted. So this is the deal. Thyroid autoimmune disease is very common. In fact, autoimmune thyroid diseases, also known as AITDs, are the most common autoimmune disorders in the Western countries. And get this, they go over 5% of the general population, according to the study published in 2007. 5% of the population is dealing with a thyroid autoimmune disorder. These diseases are also known as Hashimoto's, Graves', autoimmune thyroid diseases. Are you a dog lover like I am? I have a good story here. So we have 2 dogs, and just a few months ago, I was sorting through some health issues with my dog, Zoe. We discovered a functionally low thyroid. I found that they can have autoimmune diseases just like humans do. So when a dog is positive for a marker called thyroglobulin antibody, this is a marker that I test in humans in my blood work, my incoming blood work on patients. This is noted as a genetic marker in dogs, meaning that a breeder cannot breed a dog without or with a positive marker. It's a genetic marker. So here in humans, in the human world, we don't think a thing about it. And most doctors and OBGYNs never test their patients for that autoimmune disorder, the antibody. So side note, Zoe, my dog, was not positive, by the way, but this is what gets me. My family is. It's in my family history and it's genetic. So when it's genetic, it goes from parent to child, passes down that line. Don't you deserve to know if you have an autoimmune disease when your doctor suspects your thyroid is the culprit, right? So this is why I encourage you to look at these 5 things if you're concerned about your thyroid. So answer these questions. Number 1, how is your iron? And I mean a full iron panel, including ferritin, because iron really affects how that thyroid functions. We've got to make sure that iron is on track. 2, how are your other minerals and electrolytes? Minerals are super important. They're like the little keys that get the factories running in your body. You need to have those minerals, getting those factories and those genetic components, those enzymes working properly. Electrolytes, meaning sodium, potassium, magnesium, calcium. Those are needed to move enzymatic reactions. Selenium is super important with thyroid function. Number 3, ask your parents if they've had thyroid problems or if they've been on thyroid meds, if you have the capability to ask them. So Hashimoto's is a genetic disorder in humans and dogs as well, and it will determine if you really should be eating gluten ever again. It's a big deal. So ask your parents. Could you have it? It's possible. 4, do you have a positive thyroid peroxidase, TPO antibody, or a thyroglobulin antibody test? Ask your docs to check. 5, how is your blood sugar regulation? If you are sluggish, my number 1 secret tip is you got to regulate that before you start chasing the thyroid. It's super important to get that dialed in first. Diet is huge. So what have you found that works for your sluggish metabolism? I want to know. Comment below. If you want to dig more into what I do, watch my 45-minute masterclass, 5 mistakes women make that prevent them from shedding weight. Or join my Facebook group, Keto, Fasting, and Functional Medicine. This is Dr. Emily with Enlightened Functional Medicine. Be a light to the world, love others, and invest in yourself.